For the introduction, and while my tech support is just uploading my slides, I'd just like to introduce myself. I'm a consultant hematologist at the Hammersmith Hospital. It's a great pleasure to be here, and it's also a great pleasure to see so many familiar faces from our clinic, all our patients who have come today, so that's very encouraging. Thank you, Mari. And well done, Sebastian. I remember when I did the side effects talk, I usually have Professor Clark pacing up and down because it was a very short talk when we only had one drug, but now we have 5. There's quite a lot to get through. So the title was Adherence to Tyrosine Kinase Inhibitor Therapy, Still a Problem. I would also say it's always a problem, and it's something that we need to bear in mind. So CML doctors weren't the first to look at compliance with tyrosine kinase inhibitor therapy. We know from other chronic diseases and chronic illnesses that this is a big problem. It's an undertaking for the WHO to try and improve adherence to all patients for all their drugs. So we know that in cardiology, which we've heard about, to stop you getting a heart attack and a stroke, you have to take your medicines very regularly, but 1 in 7 patients, as you can see, miss their medicines. In HIV medicine, there's a lot of drugs that need to be taken several times during the day, and these are taken in rotation, and as you can see, only 12% of patients take these regularly. But what was surprising is that in cancer therapies, if we take breast cancer, only about 20% of patients take their breast cancer chemotherapy on a long-term basis. So we looked at compliance to TKI therapy at the Hammersmith, but this has also been looked at before. And our colleagues in Belgium found that only 30% of patients took their medicines as they should have done, but they did it in a different way by looking at pill counting and patient reporting. We've heard that you can take these drugs once a day, you can take them twice a day with fasting, you sometimes have to take them after food. So you would think that either once a day or twice a day adherence to medication will make a difference, but this hasn't been proven by many studies. So some say once a day medication, patients have better compliance, and some say with nilotinib, twice a day medication also gives you better compliance than the once a day medication. So we don't really know, but we know that the more tablets that you have to take, the worse your compliance becomes. So this is a study that we did at the Hammersmith with my colleague David Marin. It was some time ago, but it still holds true, and it's the most accurate way that I think has ever been reported for patients' compliance to therapy. You have to remember that these 100 patients that kindly participated in the study were very good responding patients. So they had a complete cytogenetic response, and some of them had deeper responses. So we signed them up ethically to a trial of adherence or compliance. They brought all their imatinib back into the hospital, and we gave them imatinib in a different way. We gave them the drugs, the pills, in a container. So although they signed up to a consent that they were undergoing a study for compliance, we didn't tell them the exact details of the container. Each time this container was opened, there was an electronic chip in the cap which recorded the time that the pill was taken. But our patients have forgiven us since, and they have known that I think they suspected there was something about this unusual container that they knew that we were monitoring. It's the most accurate way of testing compliance in all conditions. And we were very surprised, if you see at the bar right at the left here, that only 40% of our patients took their medications as prescribed. The green bars are what the patients think they are taking. So we can see that patients think they are really good at taking their pills. And if you do the pill counting way, so that you do returns or you see how many prescriptions have done, it's not as accurate as this particular way of screening patients' compliance. So this is an example of how the data can be represented. So this is consent. Patient goes into a trial of compliance. They know that we're looking at this, and after seeing the doctor, it's very good. Every day they open the container once, and this is imatinib 400 milligrams once a day, and they take their pills every day. So a lot of you may recognize this pattern of behavior, but as you get away from seeing your doctor, you tend to then miss the odd medication. And then when it comes to Christmas, or another holiday period, then sometimes you don't take any medication at all because there are various interactions. The medication can make you feel unwell. So as we go further away from the clinic, the compliance becomes more erratic. And then finally, coming back, the patient remembers, I'm on a study for compliance. I now will take 2 of my pills because that will set everything right. So when we said, how have you got on with your compliance? Perfect, 100%. We gave more pills because you've all had your clinics shifted back and we don't want you to run out of medication, so we put more pills in the container, and more pills when removed than should have been for that period of time. But only the microelectronic monitoring system, or MEMS, was able to accurately show the exact percentage of compliance. So I'm sure these are some of you. Perfect patient, every day, once a day, best possible way of taking your medication. But then we also have this. I've taken 2, maybe by accident, then I won't take it for the next 2 days. Or I'll take 2 because then I want to have the weekend off, and then I will go back to having the medication every day. We can also look at it this way. So taking your medication very regularly at the same time, and these red bars are not taking it at all. But this shows, actually, this patient was very good, apart from the odd mishap. We also see this pattern where you miss one and then you say, oh, better take 2 tomorrow, just in case, just to set everything okay. We could also see the times. It can be very erratic. So you can see if you take it in the morning and then you take it in the evening, you're bound to, at one point, not take it at all during the day. So that's in a very erratic way of taking it. We also saw this pattern, so excellent compliance, but then I want to go on holiday for 2 weeks. I want to eat and drink and have no interactions with my food. I don't need to fast. Or perhaps you've forgotten to pack the medication and you end up in a foreign country without any source to TKIs. So this is all very interesting. It's not particularly meant to be so amusing, but it does make a difference to the outcome of the CML, which is the serious message that we are giving to our patients. So if you take your medication very regularly, you'll find that this goal, the standard of therapy, which is major molecular response, which is termed the safe haven because it stops you from progressing, those patients that took more than 90% of their tablets, they achieved it much better than those that didn't. So it is quite a dramatic difference. And we are talking about complete molecular response at various thresholds. But in order to get this very deep molecular response, then you really need to take your medication in order to get that. Because here we can see, again, patients who skipped doses weren't as likely to get that deep response. It does reflect into losing your response. So 20% of those patients that didn't get that deep response, which is termed major molecular response, went on to lose their complete cytogenetic response. And this also reflected in what happened to the CML after this occurred. So sticking to your medication, lots of reasons and lots of publications and research into trying to understand why some patients take their medicines and some don't. Of course, it depends on what type of person you are, whether you're very motivated or whether you think that maybe you can interpret some of your results yourself in order to guide you into taking your tablets. The regimen that can make an influence on how often the pills are taken. Lifestyle as well, whether you're flying abroad a lot or whether you are a shift worker and perhaps twice daily medication may not be the best for you. But what we found that the greatest influence is side effects of treatment because if you are going to take a medicine that makes you feel unwell, then you're really not motivated to take this. So although there are a myriad of reasons about why patients don't take their pills, we can divide them neatly into those patients who don't want to and those patients who forget. When you start treatment, you can find that the forgetting tends to get better with time, but trying to interpret your results and stopping the medication or taking these holidays tends to increase with time. We also went out to interview our patients after the study had been completed to find out what patients' views were. And in fact, most of our patients felt very positively towards stopping their medications because they felt so much better off the medication. But some also felt that if you had a good relationship with your specialist nurse and a good relationship with your doctor, that even though you had side effects, you were more motivated to take your tablets. So what can we as physicians do about this? So for the intentional, that I don't want to take it so often, it's making me feel unwell, I'm going to miss it because I am having side effects of therapy, it's highly important to think about whether changing to another drug with a different side effect profile can help. Our interpretation is that there is no cross-intolerance between the pills. So if you're on one, if you're on imatinib, have terrible side effects, you can in fact have all three of them in your discussion. You can have bosutinib, you can have nilotinib, you can have dasatinib. So it's between you and your physician which one you think would suit you best. We've spoken about the specialist nurse. Studies have actually shown that the specialist nurse can double patients' compliance in more recent studies, and the pharmacists as well, that can go through and tackle what additional medicines we can give in order to make the tolerability of these agents better. And for those patients who forget, lots of things, mobile phones, other family members trying to prompt, have you taken your medicines, having it beside your toothbrush, all these things tend to prompt patients to take and not forget their medicines. So with all that knowledge, what we've said about the data so far is that we are trying not to be accusing when we discuss compliance, but we're also trying to give very clear messages. So when we have said to our patients who've had terrible infection, needed some antibiotics, had gastroenteritis, didn't take their medicine, said, is everything okay with my CML? We have said, don't worry about it, it will be okay. So we're trying now not to say missing the odd dose is okay or missing a block of treatment is okay, because our patients then said, well, it's okay last time, so I think it'll be okay this time. So instead of saying that, we now say what our data has shown. So if you miss more than 2 doses in a month, that's 2 days in a month, that's likely to affect your response and your depth of response. And instead of saying the very open, have you missed any tablets, because everyone immediately wants to say, no, I haven't, is to say we know that patients miss tablets and patients know they miss tablets. So when they come through clinic, we should be saying, good morning, how many tablets have you missed? And it's another way around of saying that. So in summary, we know it's an ongoing problem, but we also know it's in the majority due to side effects of treatment, and we are very lucky that we have this quantity of oral tablets in order to be able to see which of the medicines suit you best. We can also reduce the dose, because the dose intensity, the amount of drug you're taking, will influence the side effects, because side effects will improve with dose reduction. We still maintain that in patients, sticking to your medication will improve the response, and these drugs are extremely good, but only if you take them. And with that, I'd like to thank you for attention, thank all the patients at the Hammersmith who forgave us and are still doing trials at the Hammersmith, and you for your attention.